Okay, this video is called If Michael Jordan Was a Doctor. Okay, so I'm going to show you a picture of Michael Jordan. So here's Michael Jordan taking it to the hoop. All right, he's got his tongue sticking out. So anyways, he gets called into the owner's office. And the owner says, look, Mike, the local high school canceled your speaking appearance. They say you're too aggressive. You are a bad role model for the students. And you need to stop sticking your tongue out. A female fan complained. She said that you're making lewd gestures at her. MJ, that's bullshit. I just do that subconsciously. Owner, don't swear at me. You also need to go to anger management classes. MJ, I'm just trying to win. Owner, well, stop it. What do you mean, stop it? Owner, don't you get it? We make more money when the team loses. The fans buy more beer and pretzels. That's the kind of productivity we need. MJ, what? I play to win. Every red blood cell in my body wants to win. Owner, if you continue with that attitude, we are going to have to let you go. Why can't you just trash talk more often? Do some fancy dribbling. Dance around like the Harlem Globetrotters. That kind of stuff, it fills the stands. We make lots of money like that. Why can't you be like the Harlem Globetrotters? MJ, the Harlem Globetrotters are a bunch of clowns. I am not a clown. Michael, no one cares about the game. This is not a game. This is business. We are in the entertainment business. Either you get with the program or we will fire you, and we will blacklist you so that no NBA team will ever hire you. Okay, explanation. Doctors are paid and protected for selling drugs and surgeries and imaging tests and blood tests, and for providing treatments that never win. They never want to cure the patient of a chronic disease. Pills and surgery will never cure the chronic dietary disease like obesity, hypertension, diabetes, coronary artery disease, cerebrovascular disease, okay, chronic kidney disease, etc., and a whole bunch more of them. If the doctor tries to cure the patient by offering the low-fat vegan diet, they won't get paid for it. They can get sued for not following the standard of care. The patients don't like it. The doctor's going to have to work much longer hours because they're under pressure from a bean counter at every clinic and hospital in the Western world to go as fast as possible and generate more billing codes. So there's a good chance they'll lose their job, or they're going to be working really long hours to the point where they're sleep deprived. Because remember, a patient cured is a customer lost. You cure the patient, they go home, they don't need any more pills, they don't need the doctor anymore. The medical system does not want the patients to know that the power is in their own hands. And I'll just give you one example of this, upside down, backwards thinking, how this relates to a doctor's life. I wrote a book. It was a great book. It was called Journey to Optimal Health. And I talked about fecal transplants in there as a treatment for autoimmune disease as a last resort. Really, they should be doing diets instead, of course, but they do fecal transplants through a colonoscopy. And I made a joke that a wife, if she didn't want a fecal transplant, she could just kiss her husband's ass and take shit from him. It was just a joke, okay? But a university medical center banned me from teaching their medical students, said that my language was inappropriate, just for a joke, a fart joke I made in a book. And because of that, and I know who complained. It was a lady doctor who was pissed off because I made fun of her field. So she got me banned from her university for teaching students. And that's insane. But anyways, that's the kind of stuff you get. You get in trouble if you try to cure the patient. It's insane.